Hi, my name is Ahmad Nazrul, and today we are going to talk about tennis elbow. Before we know more about this tennis elbow injury, let's take a look at the anatomy of this injury. For the bone, there are two types of bone that are involved in this injury. First, we have the humerus, which is located at the upper part of the arm, and the ulna, which is located at the lower part of the arm. As we can see, the lateral epicondyle is the part that is responsible for the connection of the lower arm and the upper part of the arm. The tendons that connected both bones and both muscle at the upper part and lower part is called the extensor tendons. As we can see here, the extensor carpi radialis brevis, or short form as ECRB, is usually the part where the athletes got affected and the pains occur at the part.
Okay, for the anatomy of the joint of the elbow, on our elbow there is a part which is we call as medial epicondyle of a humerus, which is inside of the elbow.
Hi, hello guys. Today I'm going to talk about the radial collateral ligament injury. Alright guys, this is the anatomy of the radial collateral ligament. Alright, the radial collateral ligament is provide a very stability to allow the rotation for the hand.
Okay, my name is Haris bin Muhammad Khairi from RSR2434A. So I'll be continue on the anatomy of ulnar collateral ligament injury. So as you know that UCL is located inside the elbow, which is attached on the humerus, and the other side is ulnar, which is humerus is upper, ulnar is lower. Right. The next one is it consists of three division, which is anterior, posterior, and transverse, which is across.
So, what is actually this tennis elbow? Tennis elbow, also known as lateral epicondylitis, is a common injury for the tennis player. This is usually caused by the overuse of the elbow and could be due to inflammation or from the macro tear of the tendons. Usually, most people who get tennis elbow are aged 30 until 50, but this injury is usually common for other ages as well. In sports such as badminton and tennis, improper stroke technique usually can lead to this injury. Proper care from the therapist and doctor can help the athlete to treat this injury. And this injury is very common for the tennis elbow. This injury is very common for the tennis player, hence its name, tennis elbow.
The common injury that usually occurs in our elbows is golfer elbows, also known as thrower's elbows. Okay, here is the sign and symptom of golfer elbows. And here for the causes of golfer elbows.
Two types of the common injury, and for the first one, it caused by the fall on the outstretched hand. The second one is caused by the dislocation of the ligament and cause a tear of the ligament. And the last one is the overuse that occur at the injury part and cause the severe injury.
So the common of ulnar collateral ligament injury, which is the athlete is experienced by repetitive stress on the elbow ligament, and it is causing to tear or rupture. Alright, so the next one is baseball pitcher is require overhead arm throw, which is really exposed to UCL injury. For field sport, you can see that javelin and short putt is exposed to UCL too.
Hi, my name is Muhammad Adib bin Ishaq from class RSR2434A, and today I'm going to share with you about mechanism of injury for tennis elbow. Let's go. For mechanism of injury for lateral epicondylitis, or known as tennis elbow, it usually involves repeated stress to the large muscle group on the outside of the elbow and forearm. The muscles can also suffer small tears caused by improper technique or muscle weakness. Examples include using poor form when hitting a tennis backhand, repetitive use of a hammer or screwdriver, repetitive gripping, and excessive typing on a keyboard. Person who got tennis elbow tend to feel tenderness on the outer body part of the elbow, morning stiffness with persistent itching, forearm soreness, or an increase in pain with gripping or holding objects.
For mechanism of injury, which is also defined as how you get the injury, the first one is repeated, forceful or wrist flexion. The second one is twisting the forearm while throwing. The third one is chronic overuse at the same time.
About the mechanism of the injury, there's impact on the joint area, which is the elbow joint, and it leads to the ligament tear.
They have two events, either acute or chronic. Which is acute is a sudden accident, which is the person experience a traumatic fall, for example. And for chronic is mostly happen to athletes or sports person, which is they experience by repetitive movement and stress by their elbow ligament. Right, it can be graded into three parts, which is grade 1 is not tear but it is stretch, and grade 2 is partial tear, and the last one is complete rupture or complete tear.
First, ask the patient to make a fist, then stabilize at the elbow and pronate the patient hands while asking her to extend the forearm, and then grasp the fist. If there is any pain indicator, that means the patient is having tennis elbow.
Now it's my turn and I will talk about meal test. Okay, the first one I will talk about the procedure of doing the meal test. Okay, the first one, the client need to be in static position, either sitting or standing. Okay, for the second step, the therapist need to palpate the lateral epicondyle of the patient with one hand. After that, the patient's forearm must be pronated. Okay, for the fourth step, the wrist must be in fully flexed and extend the elbow. Okay, for the last step, the presence of pain in the lateral epicondyle insertion area indicates a positive test to this meal test. Okay, now I will conduct a meal test for lateral condylitis injury, or also known as tennis elbow injury. Okay, the injured hand need to be pronated and the wrist need to be pushed while the left hand of the therapist on the lateral condyle. Okay, the test needs to be stopped when the patient feel the pain on the lateral condyle. Okay, as a conclusion, elbow injury can be worse if not diagnosed and treated well in the early stage. Okay, for the second one, the special test must be suitable with the type of injury. For example, if there is tennis elbow injury, the Mills test is suitable with the type of injury. Okay, the last one, the rehabilitation program need to be followed by the patient to increase the range of motion and come back the elbow as a normal as before they get the injury.
Hi, Assalamualaikum. For the purpose of monthly test is used by clinicians to confirm the diagnosis of lateral epicondylitis, tennis elbow. Epicondylitis represent a degenerative process involving the origin of the extensor tendons at the lateral elbow and the flexor pronator muscle group at the medial elbow. Let's see how the test is done. Ensure patient is in comfortable position. Stabilize the humerus and palpate for the lateral epicondyle. Ask the patient to pronate his forearm. Resist extension of the third digit of the hand distal to the proximal antiphalangeal joint. To test the positive, if patient complains about sudden pain at the lateral epicondyle.
There is so many special tests that we done when we injured at the elbow part. But for me, I choose a golfer elbow. And the test that I applied to my patient is medial epicondylitis test. Patient must be in standing position and then fixate the humerus of the patient and palpate the medial epicondyle of elbow. Then passively supinated the patient's forearm and then hold the palm to fully extend. And the last part is push until the elbow gets fully extension. So, for the result test, if the patient feel the pain at the medial epicondyle of humerus, it means the result is positive, means the patient feel the pain. If the patient did not feel the pain, it is negative result.
Okay, now I conduct the elbow varus instability stress test. Now I will palpate the radial ligament, and then I will up the hand into the proximal 20 anti-degree position, and we apply the adduction, and we'll find the tense ligament if the patient have the injury.
So now I will proceed on special test on ulnar collateral ligament injury. First step, you need your subject to standing position like this, and then get your hand in external rotation, and then palpate your ulnar collateral ligament just below the medial epicondyle. Okay, so the second step would be get your patient with flex degree 20 to 30 degrees for flexion elbow, and then apply abduction force or valgus force like this. Positive results show laxity and pain from the patient.
Okay, now I will talk about the do and don'ts for meal test. The first one, the patient need to be in static position, which are in standing or sit position, and do not do when the test when the patient move to optimum the result for the test. Okay, for the second one, the task need to be done gently and do not do the task with rush because it will cause the increase the level of the injury for the patient. Okay, the last is the test must be stopped when the patient feel the pain on the lateral epicondyles, and if the test continued although the patient feel the pain, it will harm the patient and it will increase the time to recover.
Okay, now I will talk about do part, which is the part that makes this special test successful. The first one is patient must be in the standing position. The second one is stop when patient feel the pain. And the third one is do with a proper technique. Next, I will talk about don't, which is patient cannot move while patient test being applied, means patient cannot do any other movement. Second one is if the patient exceeds the limit of pain, do not force to continue. The third one is do not perform with wrong technique to prevent some more further injuries.
Now I will talk about the do and don'ts. Alright, for the do, for the first one, the patient can do in the sit or stand position. And for the second one, we must do the test in a gently motion. For the third one, we need to ask the patient permission first. And for the last one, we need to stop the test if the patient feel the pain. Alright, now is the don'ts thing that we can't do when we did the test. For the first one is we can't do the test if the patient is moved or in the moving motion. The second one is we do in a rush motion, or we will do in a rush time. The third one, we cannot do the test whenever without the permission from the patients. And the last one, we cannot do the test if we didn't stop when the patient feel the pain.